Hi viewers, welcome back. In today's video, we are going to talk about research. Okay, so this is an introduction topic about research. Okay, so today we will discuss what is research and what is the purpose of doing research, the purposes of research. Okay, so what is research? Research is a systemic, planned, problem solving process to assess or analysis or to find out something new. Okay, so research is something you are going to analyze, a critical analysis to find out something, either what has happened before, or you are going to find out a solution, or otherwise you are going to formulate a theory for the future. Okay, so anything where you are going to do a detailed analysis is called as research. Okay, so today we will see the purposes of research. Okay, so why do we do research? Okay, now you would have studied in the first year that nursing, one of the biggest component or the biggest purpose in nursing is research. Okay, so you must have a constant research, ongoing research, so which is going to prove that nursing is a profession. So, okay, you know the importance of research, that is we have to get updated, that is the thing we need in nursing. So when you keep on getting updated, our profession becomes more strong, it becomes more evidence based. You are telling informations with some evidence or with proof. So that is meant by research. Okay, so that is the main reason why we do researches. Okay, so now we see we have lot of list. Okay, so why do we do researches? So the first purpose of doing research is unravels the mysteries of nature, that is to find out what has happened in the past. Okay, to rule out something, that is like you want to do study. Okay, see, research is something, it is a very vast topic. Okay, so now there are different type of researches, so that is in the further classes we will be discussing. So now when we come to the purpose, the first purpose is the to rule out the mysteries, that is like to find out what has happened. Okay, that is like what we say is like, it is like a you are going to find out the reason. Okay, so nowadays like we say many parents are left in orphanages, many parents are not being taken care, many children they become socially unacceptable children, they are not fit to the society. Okay, they don't have adequate social skills, that is like helping nature is not present. So what is the reason? You do research, you find out. Okay, so you find out what is the reason behind all these things, so to reveal the mysteries. Okay, so when we have done these type of researches, you have found out many things: lack of parental support, single marriage, divorced like parents and children born to these divorced, and like children who are not taken care during their childhood period, inadequate parental guidance. All these things have led to this socially unacceptable behavior. So nowadays we are learning, or like we are seeing many psychopath theories. Okay, we are seeing many films coming with like psychopath individuals, it is coming. Why it comes? Okay, psychologically they are not born up. So how do you find out all these things? It is because of research. Okay, you do research, you find out what is the reason behind all these things. Okay, so you have to find out and tell why these type of socially unacceptable behavior are present. Okay, so that is the reason where you are going to reveal the mysteries, or otherwise you are going to lighten the hidden information. So whatever is hidden, the previous informations, whatever is hidden, that you are going to lighten up with this nursing researches. Okay, and then we have contributes to the theory building. Okay, we have studied about many theories. Okay, so self-care deficit theory, King's theory, like lot of theories we have. These theories are going to support our nursing process, but how do we find out these theories are effective in taking care of patients? It is just because we do researches. to do research and find out whether this theory is sufficient to deal with these patient conditions. Okay, so whether this will be helpful to find out or to rule out these patient, to treat the patient, to make the patient recover, all these things to find out, you are going to do researches. And then verify and test the existing facts and theories. Okay, so we are now like in all the areas, not only in nursing, in medicine, in engineering, everywhere there are okay contents, the existing facts. Okay, you have your traffic rules, those type of facts. Like when we come into nursing only, when we do researches, you find out new facts and things. That is like you would have heard of heparinized saline pushing when the patient is on some drugs, okay, or like there is a Venflon, and like what you have to do, every 6th hourly you put a hep flush saline, you flush that line and you make it patent. Okay, you see to that there is no thrombus formation. That is the reason for doing a hep saline flush. But nurses, they were doing constant research and they were finding out, instead of doing hep flush, just a saline flush is sufficient. Okay, that is like instead of doing heparinized saline flush, we can just give a saline flush, just a saline flush. So that is going to make the area patent. So Venflon are not going to cause any thrombus or infection to that particular vein. This, how does this been found out? It is because of the nursing researchers. The nurses who were working in the hospitals continuously, they had a doubt like why we have to use this heparinized saline. Then they started using only saline, so which was helpful. So how you are benefiting the society? You can save the money of the patient. Instead of using heparinized saline, just a saline push is sufficient. Okay, how do you find out all these things? It is because of repeated research findings. And then we have exploratory studies to find out new things. Okay, so when I was doing my PG, I heard my area of interest, like I belong to OG department, but one of my friend who was there in the community department, she was planning to do a study. So that study was like, this was already a study which was done in an hospital. Okay, so now we want to like make the study little more practical. So when you want to do something innovative, when you want to do something good to the society, when you want something to come into practice, you must have lot of evidence. So these nursing researchers are going to help to bring out evidences. So likewise, her study was like, you know, preterm babies. Okay, preterm babies, the main problem with preterm babies is thermoregulation. The baby doesn't have adequate subcutaneous fat. The baby cannot have a adequate thermoregulatory process, and that is the reason you keep these babies under incubators. But this one of my colleague, what her study was like, it was to do a study with like to roll a plastic cover on the baby. Okay, so that is like to cover the baby. So instead of providing a kangaroo mother care, she was doing a study to find out whether wrapping the child with the plastic sheet can hold the temperature of the baby. So when you keep on holding the baby inside this plastic cover, this is not going to allow you to go in for your like heat loss. So at that time what happens? So you will not have, you know that 4 types of heat loss. What are the 4 types of heat loss? It is your conduction, convection, radiation and evaporation. So your conduction and your evaporation is not going to happen when you are using a plastic cover to wrap the child. So you wrap the child with a plastic sheet and you make the child lie down like that. So what happened? The baby's temperature is going to be stasis. The baby is going to hold the normal temperature and the baby is going to put on weight very easily. So now this is going to be a beneficial study to the society. Okay, so very interesting topic, and she did this study and that was being published, and the hospital accepted the study, and all the babies who all were born preterm, they were using this methods to maintain a thermoregulatory system. Okay, so very interesting and it was very useful study. Likewise, when you do researches, it has to benefit the society. So it is like exploratory to find out something new to the society. So you are going to benefit parents, benefit the hospital instead of wasting the baby with incubators, like too much separating mothers and the child. So these are all like exploratory studies to do something good to the society. And then we have descriptive studies. So descriptive studies or portraying studies, that is like descriptive. So already there is a content and you are going to find out about the content. Okay, so just imagine a study about Abdul Kalam, a study about a patient, a particular patient you take, maybe a patient is having myocardial infarction. So you are going to do a descriptive study on this particular patient and the particular condition. So what you do, you start talking about this condition. So you are going to describe the qualities of the patient, describe the qualities of the condition, compare the qualities and the characters of the patient and the condition. So this is going to benefit the students who are forthcoming. You are going to help the students who are going to study about myocardial infarction. So that is like you are going to describe about the patient and the condition. That is called as descriptive study. That is your descriptive nursing research studies which are going to explain about the conditions. And then we have diagnostic studies or to identify. See, when you are doing something, you must have a rationale. We always say you do something, you are going to find out why you do this. So when you do something with the rationale, that procedure is accepted. So that is the way. So when you are doing a perineal care, so how do you do? It is from inside out. So why do you consider that? The perineum, it is more clean in the center part than the outer region. So center to periphery. When you do a dressing, how do you do? It is from center to periphery. So it is like you consider the center part is going to be more sterile than the outer part. So the circumference, it is going to be more contaminated. So you consider this is going to benefit the society. So you are going to have an evidence, you are going to find out which is going to help the society. So for that also your researchers are needed. Then we have the causal relationship or the cause and effect type of studies. Okay, so you do something, you get something. My PG study was like use of cabbage leaves to relieve the breast engorgement. So now what I am studying, okay, so I was using cabbage leaves to, like, it was a comparative study. So where I was using cabbage leaf for one set of samples and I was using jasmine flowers for the other set of patient. So this cabbage leaves I kept over the brazier of the one set of mothers, and to the other sample they were using jasmine flowers. So what happened? So I am doing a comparative study which is going to help in relieving this breast engorgement easily. Okay, so it was a so beautiful study. So when you provide treatment, what is the effect of the treatment on this engorgement? So it is going to help all the mothers. So it is going to tell the mothers, when there is a breast engorgement, you can just apply cabbage leaves inside your braziers or your blouses, like whatever you are wearing, and you can just leave it like that. The breast engorgement will come down. So cause and effect relationship. So how nicely you are going to like explain, when you do something, this is the effect. So your effect is the breast engorgement is coming down. So likewise you are doing nursing researches. And then we have interrelationship between variables. So when we come to the interrelationship between variables, so you are using two treatments, that is like either cabbage leaf or a jasmine flower, that is like to find out which is more effective. In some disease conditions we will be using two drugs, okay, so one type of drug and another group of drug, and you will find out which drug is more effective on the patient, which drug is having little side effects. So all these things to compare the values, and then you can start implementing on the other patient. So this is the way you will find out which is more effective, with what we can treat the patient more easily. And then comes the finding solutions, that is like to find out, you have a problem and you are going to find out a solution for the problem. The problem can be in any type. So it can be a socio-economic problem, it can be a health related problem, it can be human relationship. Okay, so I will tell you an example. See, a common type of study, a very common type of study to assess the mental status or the stress level of the attenders for patients who are mentally sick. You are able to understand the concept. So, it is like you are going to assess the stress level of the attenders or the accompanying patient, the relatives, the husbands or the friends like who are staying with this mentally unstable clients, the psychiatric patients, okay, to assess the stress level. So, now what are you going to do? You are going to assess the stress level of these attenders in taking care of these type of patient, and you are going to find out solution, that is to how to control these stress, how to manage these type of problems you are going to tell. Okay, so that is like this is not only like psychiatry type or medical types, everywhere it is like you want to find out a solution for a problem. So, that is one of the major reason why do we do researches. And then we have develop new tools, concepts and theories. So, this is like in olden days we were doing that, now also. Why? It is like to make innovations, to find out new things, to make ourselves more convenient, comfortable, to make it fast, smart way of working. All these things can be done only with researchers, not just sitting and not just doing or the repeated things what was carried in the past. Okay, so you have to keep on changing with your researches. And then we have formulation of strategies and policies. So, when you want to formulate something new, you want to have evidence. So, when you want to have evidence, you have to do researches. Now, also there are some hospitals where you don't do perineal preparation. That is like when you go in for a surgery, what you do? You go in for skin preparation. That is like you shave that particular area, you see to that there is no hair follicle, sometimes it may cause infection. That is the reason where you are going for skin preparation. But when you are going in for a labor, you don't go in for perineal preparation. That is like you don't go in for preparing the area, the vaginal area for delivery. Sometimes there are hospitals where they go in for perineal preparation. Some hospitals they don't go, they tell there is no preparation. That is in the sense they don't shave the perineal region, because they consider like every hospital has its own policies. Some hospital they consider this is a normal birthing process and nothing is going to cause abnormal. So, the child is born, healing is going to take place naturally, let it heal by itself. So, this perineal region is prepared for childbirth and nothing, this perineal hair is not going to harm the child. So, that is one of the policy in one hospital. The other hospital they want the area to be more clean so that the child travels the area. Okay, so that is the reason. So, it is like you want to do an analysis to find out which is more better, and you make that as protocols or policies in that particular organization or institution. So, to formulate all these new formulas and policies, you are going to do researches. Okay, so you have lots and lots of reason why do we do researches. Okay, so now, so the purpose is like unrevealing the mysteries of nature. So, contributing to theory building, verifying and testing the existing facts of theory, exploratory studies and new insights, descriptive studies, then diagnostic studies, causal studies, that is your cause and the effective studies, interrelationship theories, finding solutions, developing new tools, concepts and theories, formulation of strategies and policies. So, these are the very important or the main purposes of doing research. Hope you understood this introductory class to research. So, let us meet in the next topic. Till then, take care. Bye.